In stage 1, cancer cells can be distinguished from normal cells. The cancer cells are still localized, and removal of the tumor usually results in a cure. In stage 2, the cancer cells have begun to metastasize and may have migrated to nearby lymph nodes. That is why lymph nodes near the tumor are removed and examined to determine whether cancer cells have spread. By stage 3, the cancer cells have spread throughout the body and tumors may have begun to grow in other organs. In stage 4, often a terminal stage, tumors are found throughout the body and usually are resistant to treatment.
Has gum cancer. Most have this phase.
Do you know any risk factors that may have caused that?
Nicotine addiction, cigarette smoking.
Yeah, the way you take care of your body, yeah.
How about you? There are several environmental and lifestyle risk factors that contribute to cancer. The first one being nutrition. About half of cancer deaths are caused by nutritional problems. This is due to excess calories, excess fat consumption, obesity, and nutritional deficiencies in fiber and vitamin A. Cigarettes and alcohol also contribute about 1/3 of cancer deaths, and this is due to excessive alcohol consumption and constant smoking of cigarettes. Occupation also contributes to cancer. About 5% of cancer deaths are caused by substances in the workplace, such as asbestos, benzene, and vinyl chloride. Radiation accounts for 3% of cancer deaths through the use of X-rays and ultraviolet light. And other cancer deaths result from heredity, chronic disease, drugs, and infections. So, do you know any forms of cancer, or the most popular ones?
You're gonna change the question? Lung cancer and breast cancer is probably the most popular ones today.
Do you have any family members that suffer from cancer?
My aunt suffered from cancer. She had a molar pregnancy, so her fetus was an unborn pregnancy, so that the fetus turned into a tumor, and she had cancer.
Is that a rare form?
Yeah, it is actually a rare form. She had to go through chemo, and she's fine now.
That's good to hear.
Yeah, it is.
Well, thank you very much, Chuck.
You're welcome.
Lung cancer is the deadliest of all cancers worldwide. In the United States, lung cancer is the number one cause of cancer deaths for both men and women. About 225,000 new lung and bronchus cancers are diagnosed in the United States every year, which accounts for about 50% of all cancers. More women die each year from lung cancer than breast cancer. Smoking cigarettes is the primary cause of nearly 90% of all lung cancers. Symptoms include coughing, often with blood, chest pain, wheezing, and weight loss. These symptoms often don't appear until the cancer is advanced. Treatments vary, but may include surgery, chemotherapy, radiation therapy, targeted drug therapy, and immunotherapy.
Both men and women can develop breast cancer, but it occurs very rarely among men. Although more women die from lung cancer than breast cancer, more than twice as many women contract breast cancer. Increased weight, lack of exercise, and high levels of dietary fat have all been proposed as factors contributing to an increased risk of breast cancer. Mammograms are used to detect the presence of any abnormal breast tissue. In the United States, breast cancer is diagnosed in about 200,000 women each year. About 40,000 women die annually.
Once every few months when I'm in the shower or something.
Usually I go whenever I go to the gyno.
I'm at 300.
Never.
I don't know, once a month.
I examine myself every day. You know, I gotta check for that.
And if your breast is equal to one another, to see if one is bigger and one is smaller.
Go in a circular.
Oh, you massage it like this.
You touch yourself all around. I was to see if you find any bumps, right?
Pressing down, right?
Breast self-examination, also known as BSE, should be done once a month so you become familiar with the usual appearance and feel of your breast. It also makes it easier to notice any changes in the breast from month to month. Early discovery of a change from what is normal is the main idea behind BSE. First step is to stand before a mirror and inspect both breasts for anything unusual, such as any discharge from the nipples, dimpling, or scaling of the skin. The next two steps are designed to emphasize any change in the shape or contour of your breast. Watch closely in the mirror, clasp your hands behind your head, and press your hands forward. Next, press your hands firmly on your hips and bow slightly towards your mirror as you pull your shoulders and elbows forward. Step 4, raise your left arm. Use 3 or 4 fingers of your right hand to explore your left breast firmly, carefully, and thoroughly. In the next step, gently squeeze the nipple and look for discharge. If you have any discharge during the month, whether or not it is during BSC, see your doctor. For step 4 and 5, they should be repeated by lying down. Lie flat on your back with your left arm over your head and a pillow or folded towel under your left shoulder.
I don't know, like once, twice a year.
You say you don't.
I don't. Daily. When your nuts is hard.
Look at
Like in
his
your
fingers.
testes. Isn't it when you feel like a lump or something?
Big balls.
Testicular cancer is rare and accounts for only about 1% of all cancers in American men. Cancer of the testicle is the most common cancer in men between the ages of 15 to 35. Some symptoms include a lump in either testicle, any enlargement of a testicle, a feeling of heaviness in the scrotum, a dull ache in the lower abdomen or the groin, a sudden collection of fluid in the scrotum, pain or discomfort in a testicle or in the scrotum, enlargement or tenderness of the breast. Testicular self-examination, also known as TSE, should be done once a month and should be performed after a warm bath or shower. Step 1. Stand in front of the mirror and look for any swelling on the skin of the scrotum. Step 2 is to examine each testicle with both hands. The index and middle fingers should be placed under the testicle while the thumbs are placed on the top. Step 3 is to gently roll the testicle between the thumbs and fingers and find the epididymis. It's normal for one testicle to be larger than the other. If you find a lump, contact your doctors right away. Most lumps are found on the sides of the testicle, but some appear on the front. Remember that testicle cancer is highly curable, especially when treated promptly. The 3 medical treatments for cancer are surgery, radiation therapy, and chemotherapy. Surgical removal of all or as much of a tumor as possible is considered the best treatment for cancer, particularly if the tumor is small and cells have not spread throughout the body. If there is evidence that tumor cells have spread or if some of the tumor could not be removed surgically, then radiation or chemotherapy or both are used to kill the remaining cancer cells.
Have you ever done with cancer?
Yeah, my uncle passed away from brain cancer.
Really?
Yeah.
How long ago?
I was like 4 years old, so.
Yeah. How did your family cope with that? Like, how did you cope with that at the time?
It was really hard, but I was too young to realize what happened.
A diagnosis of cancer raises serious problems for the patient and for family and friends. Often the patient enters a state of disbelief or shock, and the family has to cope with the new problem. Coping with cancer requires courage and conviction. A cancer patient must not give up hope despite what the statistics predict or what physicians say about the prognosis. The patient must believe that a cure is possible and work toward that end. For many people, coping with cancer is a transforming experience. It gives renewed meaning to life.